Hello, good afternoon, and welcome to our discussion on COVID-19 and the lessons for healthcare systems. My name is Frank Hoffe, and together with Elira Jaffa, we will take you through this webinar today. And with us are two global leading health experts. It's Rosa Pavanelli, who is the General Secretary of Public Service International, the international trade union organization for public employees, healthcare workers around the globe, and Philip Alston. Philip is a professor of law at the New York City University, and he has been the UN Special Rapporteur on extreme poverty and human rights for the last 6 years. So welcome the two of you to our discussion today. We have a couple of hundred participants in the webinar, so let me give you a few technical information before turning to our panelists. This webinar will be on for an hour. We will record this session and a summary will be posted on the web for those who could not join the session now. All of you are invited to post questions. There's a Q&A function on your screen during this session, and Elira will summarize, look at these questions, and then give these questions to our panelists so that we hope to have an interactive and lively discussion. Looking at the COVID-19 crisis, it disclosed, I think, the weakness of the healthcare systems, and we also saw quite a number of countries where the system was virtually overwhelmed with the challenges of this pandemic. And Philip, maybe I can turn to you with my first question. Why, in your view, is it so difficult, despite the many conferences, resolutions, and declarations of the last decades, to achieve really health for all globally?
Thanks, Frank. I just want to reaffirm the importance of your comment earlier about the extent to which COVID-19 has exposed the shallowness and the weakness of healthcare systems in so many countries around the world. And that tells us pretty clearly that whatever has been happening over the past decade, it has not involved the systematic strengthening of healthcare systems generally, or a move towards ensuring universal healthcare for all people, no matter what their income levels might be. I think in responding to your specific question, it's important to try to keep in some perspective the role of resolutions and declarations and so on that come from, certainly from international organizations. I've worked for many years around the United Nations. I've put a huge amount of time into helping to draft various statements and negotiate them and so on. But it's a very big mistake to think that that is going to make any difference at all on its own. It's just one part of a process. And what we know is that it can be very effective if it is combined with effective mobilization. But if there is no mobilization, and if the resolutions are not really able to make a difference to the way that policymakers and others understand an issue, then it's just going through a ritual. And I think there is a lot of that. I think people do go to conferences very often. They say, you know, if someone were to say to them casually, so Philip, why the heck are you going to New York for this conference? And I would say, with probably even some passion, I'm going because I want to make sure this resolution gets through. And I come away and I say, we got another resolution through. It was adopted by whatever body. But of course, you know, it's, if you really stand back and think about that, it's a little bit like, I don't know, I've got teenage sons, and it's a little bit like me saying, well, I just told my 16-year-old son what I expect of him for the next week or the next year. It's going to make no difference at all unless I have a strategy for following up, unless there are some incentives, unless there is some monitoring, unless there is some form of accountability. And that's what we need when we talk about universal healthcare for all. And that's where we have, I think, fallen down pretty significantly. And I'd be happy to talk about that later. But the main point is just a resolution is only one part of a much broader strategy, and the rest of the strategy needs to be in place.
And that leads me to a question relating to your idea of it requires more than a resolution, it requires a mobilization. It seems to be so obvious that everybody supports the idea there should be universal health for everybody. So my question to you, Rosa, is from your experience, what do you think are the biggest barriers of achieving healthcare for all? What is it that all the resolutions and so don't materialize, and what are you doing about it?
Thank you very much, Frank, and thanks, Philip, for introducing this discussion. And let me also commend the GLU for this very timing course on the post-COVID. We really need to imagine a different world after this pandemic. You're asking me which are the biggest barriers that are preventing to achieve health for all, universal health for all. I think that the biggest one is the fact that the healthcare system is one of the most interesting areas for business. Even after the 2008 crisis, the big world of healthcare, including big pharma, has been the only one that has not been affected by the crisis, and where employment has continued to grow even after the financial crisis. So the interest is because everyone needs healthcare sooner or later in their life, and business, multinational corporates, big insurance companies, big pharma corporates are interested to make money out of health. The second barrier, it's something that I experienced in my life. I used to work in the water movement, and I've been able to create alliance movement, mobilizing people and achieving substantial results to keep water and sanitation in public hands in my country, Italy, and in Europe, and working in many other countries. It's not the same in the healthcare system, because normally when people realize how important it is to have access to good quality, high quality health services, they are in the weakest position of their life, unable to mobilize, unable to join forces with others to fight. And they have to delegate to somebody else. And normally, you know, when you're safe, when you're healthy, you don't think tomorrow you can be sick. And I think this pandemic put ourselves in front of this reality and make us understand how important it is. And the third barrier is the fact that During many years, decades now, the healthcare system have been undermined by cuts in public spending and understaffing, and the reality has been under our eyes in the past months.
Yeah, thank you very much, Rosa. And I think what we all experience, as you said, in this pandemic has been that suddenly everybody thinks about health. Normally when we are healthy, we don't think about it. Now suddenly everybody thinks about it. And it seems to be really not easy to find the best answer to how to overcome the pandemic and use that process also to create a more robust health system. Philip, if I turn to you, and you have looked at lots of countries, what do you think are the key elements we need to deal with this pandemic successful in the moment? And also, what are the lessons? What do we need to change that we are better prepared for these kind of health challenges in the future?
I agree with what Rosa has said in many ways, of course, also, but for me, the starting point, and this will strike some of your viewers as extremely general, the starting point is to simply recognize that health is a human right. In other words, if we go immediately to talking about the nuts and bolts, about the specifics of issues that arise in different countries in the health area, we're not tackling the biggest issue of all, which is, do governments have an obligation to ensure one way or another that all of the people in their countries, citizens and non-citizens, have access to basic health care? We have seen a very steady move away from that notion, despite its central importance. It has been very interesting to look at the situation in the United States. When Barack Obama introduced his insurance scheme, now called Obamacare, there were suggestions that he should premise it on a right to health. And while he mentioned that term a couple of times, he shied away from it. He was convinced that it was too controversial, and so it wasn't part of the campaign. We then had Bernie Sanders and a number of others mobilizing precisely around the notion that there is a right to health and to health care. And what I've heard recently are various governors in different states, often states that are pretty conservative, talking exactly about a right to health care, and that being why policies need to change. So I think that's the most urgent priority, believe it or not. Rosa mentioned the issue of the public versus the private sector. Apart from the role of the big pharmaceutical companies, I think what we've also seen is a very steady increase in the role played by the private sector in health. A very good example of this is India, which is currently going through a very traumatic experience with COVID-19 in terms of the pressures on its healthcare system. India has always had, in principle, the ability for everyone to be able to get some basic health care from the public system. But what's been happening in the background is that the public system has been getting ever weaker, ever worse funded, and providing consistently lower quality care than is at all reasonable, while the private sector is flourishing. And so those who have private healthcare can get the coverage, can get the assistance they need. Those who are dependent on the healthcare system that the government runs are finding that it's just not working. So no resources, no commitment to building up and strengthening that system. I think, and this will surprise you, a third priority for me would actually be technology. Now, I'm the first to admit that technology is not an equal opportunity employer, as we say. In other words, many people are not digitally literate. Many people do not have access to the necessary equipment or broadband or whatever. But an awful lot of people do through their mobile phones and so on around the world. And it would be possible to start exploring the use of technologies, not for profit, but to enable people in distant areas, people in emergency situations, to access urgent advice. And I see all too little being done to systematically develop those possibilities.
Thank you very much, Philip. And I think you touched on really three key areas we have to look at. And Rosa, maybe you can come in here and also explain a bit more what you think are the possibilities for mobilizing people for change. And I have in mind, let's say, two groups. One is those who need a healthcare system, and the other is who work in the healthcare system. I think that are two different groups, but I suppose you work with both of them. And the question would be, if we want to get change and we haven't managed to get the change we want to change in the past, what is it what you are thinking could make a difference after this traumatic experience of COVID-19?
I think that starting from the easiest part of your question, that is related to my job, to what we do daily, that is organizing workers in the healthcare sectors. We were very much excited when in 2016 the UN adopted the recommendation on health, employment, and economic growth as part of the SDG 3 program that was adopted by the OECD, by the ILO, by the WHO, and it's probably another of those papers that Philip was mentioning before, very interesting with a lot of recommendations, but still there and nothing has been done. In that paper, we highlighted that 18 million health workers were needed to achieve the Sustainable Development Goals of health for all within 2030. And nothing has been done so far. Instead, we have seen dropping the number of health professionals, dropping their working conditions and wages. And this is also why there's less and less young people interested to access education in the health sector as nurses, as doctors, as physicians, as all the professionals that we need there. And this is happening everywhere around the world, with something that is worsening the situation in the developing world, where some countries are presenting themselves as exporters of health professionals. This endangering their capacity to respond to health need in their countries. So I think that first of all, we need to recognize that it's time to increase the number of health professionals and increase the number of health professionals globally. The health sector can contribute to the GDP globally and nationally. And we saw how much the capacity, well, the inability to respond to the pandemic impacted on our economy, even in the north rich part of the world. And so this is the first part of the response. The need to appropriately staffing the health services, but also the fact that we need to consider that the healthcare is not, as many times also we as trade unions define it, the healthcare industry, something that is producing just an economic activity. This is something more important, and it's exactly what Philip was referring. This is something ensuring fundamental human rights. There's no life if we cannot provide healthcare to everyone. And there's no economic development if there's unhealthy workers, unhealthy people around the world. And so this is, for me, the first issue. The second issue is that the pandemic had shown the limit of our preparedness to epidemics. And we had in the past example that should have alerted us. SARS is not many years ago. MERS was not many years ago. Ebola in the Western Africa was just recently, few years ago. And there were, you know, a sort of, they showed the risk of a possible pandemic. And we have been unable to deal with that. We need to prepare. We need to prepare, strengthening the capacity to respond at a national level, as the global supply chain showed to fail in this circumstance. Government has to be able to provide the necessary equipment that workers need and people need when they have to be treated under a pandemic, without having to wait that the supply chain continue to work, that borders are reopened or things like that. And finally, I also think that it's time to question the system of the intellectual property and patents and license of medicaments and vaccines when what is at stake is public health. And this is something that we need to address soon. I would say yesterday, not tomorrow.
Thank you very much. I see that in the chat there are a number of questions to the two of you, and I would like to hand over to Adlira, who has been following the questions, and she will just put some of these questions to you. I think you tried to bring them a bit together so that we can answer as many questions as possible from the audience. Adlira, over to you.
Well, thank you very much. Yes, we're having lots of questions in the Q&A here. Perhaps the first one linked to the point that, Rosa, you are making about countries that have become major health worker exporters. So we do have a question from one of these countries, from the Philippines, actually. Melissa is actually asking, what would be, in your view, a model which respects the right of workers to migrate, with the responsibility of governments in the South and especially in the North to ensure that all people have access to adequately staffed health services. And this is a question coming also in the context of the fact that in the South, countries are experiencing shortage of health workers, particularly in the rural areas.
We have programs for migration of health workers, and we have programs where we move from the principle that migration shouldn't be an obligation, shouldn't be the need to move elsewhere because you cannot survive in your countries. And we do not agree with the division of work that is assigning to some countries the role to prepare nurses and doctors and then export them. We think that each country has to prepare their workers in the health sector, particularly in the health sector. And our campaign also aims at making migration in the health sector safe, ensuring workers have the right to join a union, have the right to terms and conditions of their contracts that are the same as other workers, as national native workers in the sector, but at the same time that employers and governments takes agreement to ensure their right to go back to their original country when they decide. And we think that this is a model that has to be respected, because brain drain is part of this neo-colonial system that is also looking to human resources, not only to natural resources, to exploit in the developed world, and it cannot continue in that sense. And Philippines is one of these countries, you know. The budget of some countries, such as Philippines, consider remittances of migrants, mainly in the care and healthcare sector, as one of their fundamental resource to fund the state. Can this continue? I don't think it's reasonable and it's humanly acceptable.
Another interesting question coming again from the Philippines, from Ramon, is whether can developing countries, poor countries, also build comprehensive and resilient health systems on their own? Or is there actually a need to extend solidarity beyond borders, and perhaps create a global health insurance to support basic health care globally?
It would be wonderful if there was a spirit of solidarity which would lead governments and others to set up some sort of global insurance system. Unfortunately, that is not going to happen. And what we are seeing today is a pretty solid movement in the opposite direction. Official development assistance is falling. Even the Sustainable Development Goals are now said to be largely dependent on the private sector and not on governments. And so we need to look at other alternatives. The reality is, and I think a lot of organizations are now starting to make this case, is that even relatively poor developing countries could establish a basic universal healthcare systems if they wanted to. The problem is not that they have no resources. The problem is that they are spending those resources on other things, usually not very socially productive. And we know that the key, unfortunately, also is fiscal policy. In other words, many of the poorest countries are not even trying to tax wealthy people in their borders. They actually have provisions which exempt a lot of the richest people for one reason or another. And then the government says, oh, we have no money, we can't afford a healthcare system. Of course, you can't afford a healthcare system because you're not trying to collect taxes from those who are very wealthy and could easily afford to be paying their way.
Rosa, would you like to say something to that, or?
I think Philip touched the real point there. Sometimes we hear that the developing countries, the least developed countries, need assistance to develop their capacity to train professionals. That's actually not true. It happened to me to realize during the Ebola epidemic, when we were working with a project in Liberia, New Guinea, and Sierra Leone, that there were more Liberian physicians in the United States than those working in Liberia, trained, educated, and graduated in Liberia. So the problem is not how to train. The problem is if there is the will to put in place an effective and efficient system of health system for all. I also would like to highlight the fact that relying exclusively on charity is the not considering the responsibility of government in that area. And this is something that on the long run can be very dangerous. Taxing corporates, taxing investors where they produce profit is the right way to reduce injustice globally in general, but also looking for the money, for the resources that are available if we have the will to change the corporate tax system to provide public health care for all and public services for all. We saw during the pandemic that many governments took very deep and strong and unexpected and unbelievable decision until few weeks or days before, making available trillions of euros and dollars to invest, to protect their economy, to protect their people, to provide assistance. So if when there's the will, there's the possibility to respond to the needs of people. And the political will continue to be the major point, in my view. We'll see if we will learn the lesson after COVID. But I also think that we as trade unionists has to be bolder, maybe more ambitious in highlighting our requests, advancing our demands for a deeper change. We cannot think that going back to adapt a little bit better to the former situation will be the solution of the problem. We will find ourselves facing same, even not worse challenges in future if we don't do that.
And here's another question to both of you. So MC Bredner is asking something about the long-term care, home care and nursing home workers. We've seen the devastation in this area, and what are the next steps to improving the type of care here?
Yeah, well, we actually have no figures about what happened during the pandemic in that area. We discover some weeks later the disaster that happened in elder care homes how much they were affected, how many health workers have been infected by the virus, and the countless number of victims because of the unpreparedness of the system, but also some irresponsible decision. I come from a region in Italy, Lombardy, and from a town, Brescia, which have been among the most affected by the, and there's a reason why. The reason is because that's the right-wing government of the region has been privatizing the services since the beginning of this century, that the fund for for health system is majority directed towards the private sector, but also because at a certain point, being unable to respond to the high need of hospitalization, the regional government decided to send COVID-affected patients to elder care homes, and that was the disaster. So we are now discovering the terrible size of these choices, of this decision, the tragedy that they produced. I'm afraid we will discover later the impact of the home care assistance. Most of these people have been left alone without care, without appropriate assistance, and that I'm afraid produced more victims, but also highlights the fact that home workers are often left alone, left behind, without protection and without the possibility to organize with other workers and claim their rights.
There is a question on the WHO, and it's actually whether there is any way to engage WHO in a stronger role, which goes to inspect and enforce the need for functional health systems at the national level. So what would be your thoughts on perhaps on the broader role of the WHO?
I think the World Health Organization is actually playing a pretty important role these days. In terms of promoting universal health care. There was a time, I remember well, 20 years ago, when the World Health Organization was not prepared to talk about a human right to health, even though it was in their constitution. That has changed dramatically. They now do champion that notion, and they are pushing politically very strongly. And I think this is what the first question related to in terms of all of the conference declarations and resolutions and so on, for the adoption of this universal healthcare system. I think what we need, though, is more support for WHO. Obviously, what the United States has done, what Brazil is threatening to do, is deeply problematic. And we also have the issue that Rosa mentioned, and I think she and I have the same preoccupations, if that's the right word here, where what we see in the health area is the extraordinarily important role being played by major philanthropists. So obviously the Bill and Melinda Gates Foundation, but a whole range of other very big philanthropies play a key role in decision-making and in funding. And the strange thing is that at one level, this is great. You've got really rich people spending hundreds of millions, even billions of dollars, usually in developing countries. The only problem is that that money should, for the most part, have been taxed. It wasn't. And so the vast majority of the big philanthropists have not paid taxes. They've used various mechanisms to avoid them. And if they'd paid taxes, governments would be in a position to have set up systems which are not dependent then on individual foundations which cannot and do not coordinate effectively, which are in no position to arrive at democratic preferences or priorities as to where the money should go, and which by definition also are less likely to be investing in long-term healthcare strategies. Because if you're on a foundation, the rich man, and it is the man usually, is going to say, so tell me, Ed Lira, where can I make the biggest impact? And I'm not going to listen to you if you say, well, Philip, what you should do is to invest long-term in putting in place a health infrastructure in developing countries that will gradually benefit everyone. You're going to say, Philip, you can make a big splash by developing a vaccine, by taking one particular illness and focusing on that, and so on. So by relying on philanthropy, by basically letting governments wash their hands of the responsibility to ensure equitable tax systems and then devote resources in a systematic way, we are really abandoning our responsibilities.
I mean, there are more questions coming. So one is, and quite a few of them are actually related to the fact that the crisis somehow has, the COVID crisis has also kind of caused a crisis of legitimacy for the models that have been prevailing in the healthcare systems, being that the market-oriented reforms in the public healthcare systems or the models of the care homes and so on. So people are really asking to what extent this crisis actually have the potential to change things, and what needs to be in place that the crisis is basically not wasted.
Once again, I think that if we don't want to waste this opportunity to change, we need to put pressure on the political system to take their responsibility. It's a matter of addressing and directing in a new way policies for the health system. I think that maybe not everywhere there are still people denying the fact that there's a pandemic, the fact that we need to protect ourselves. You know, we all see what is happening in Brazil, what is happening in the United States, and even in Europe, But I also think that we need to work and try to show how relevant it is for the cohesion of our communities, for the cohesion of our society, being able to ensure health, reliable, affordable, and universal health system to all. It's not just about being able to treat a patient or not. It's about how we conceive the work in our communities, how we conceive the central role of the public. And it's also a responsibility of state public health everywhere around the world. It's not a private responsibility. I think, for instance, that we need to be more vocal towards the financial institutions when they they lend money with conditionalities that are going to touch on reform that are affecting the possibility to enjoy fundamental human rights such as health, education, water, sanitation, and all the public goods that we need to protect. I think, for instance, that there's an important role of the development agencies, either national or even thinking to the European Union, when they talk about cooperation with the developed world. Can we think that there's another way to support the development that can benefit globally our economy? And probably the fact that we all need to consider that it is no longer possible for the richest part of the world, for the wealthier, to make money out of money and exploiting human and natural resources, exploiting labor as they did in the past. It's a matter of more sustainable development. It's a matter of justice. It's a matter of environmental sustainability as well. And it's all part of a new idea of development that has to be human rights centered.
I hope we do have time for at least one more question, and it's a follow-up to one of the priorities that Philip, you raised for the future of health systems, basically to technology. And the question from Sabina Singh actually is whether you could elaborate more on the challenges and possibilities of utilizing technology for universal healthcare.
I come from the human rights area, and I've done some considerable work on new technologies. The difficulty is that people working on human rights tend only to focus on the negative side of things. We are worried about surveillance. We are worried about losing our privacy. We are worried about what technology companies do with the data that they accumulate. But when you look at the sort of investments that are being made in the health area, for example, in technology, it's always extremely sophisticated stuff, because that, as always, is where the money is. They are working on helping people like me, people who are aging but have money and will be able to pay for innovations that will be tracking various aspects of my health and flagging as soon as I need some sort of care. Very little money is being spent, certainly by technology companies who don't have the financial incentives, to say what really basic sorts of technological developments, what sort of software programs could we be developing, which would bring much more effective healthcare to poorer populations. I think that the range of possibilities is endless. Just the way in which we've all come to use Zoom, I think you'll find that a lot of even poorer people are now gradually making their way to some sort of communal location where they can go online and do what has to be done. If they could simply say, I need to get, I can't be seen by a doctor, but I can at 10 a.m. this morning have a 5-minute consultation where I explain what my problems are and get some sort of very rapid feedback, which can then be followed up again in ways notifying health authorities, notifying charitable organizations of the sort of assistance that is required. I think there are endless possibilities, but we're just not exploring them because the technology goes where the money is.
assuming we get a vaccine next year, so Mattia is asking, if we get a vaccine next year, what would be the criteria for its distribution? And who should get it first? And how can we actually ensure fair distribution?
Let me jump in. The answer, of course, is that I will get it first. Rich white men will no doubt be the first recipients. But there have been a lot of efforts led by Oxfam, Médecins Sans Frontières and others to really put this issue at the center of debate right now, because we know that unless there is a really major public coordinated effort, individual firms are going to seek to maintain the patents on these drugs and to charge high prices, and only after a significant period of time will people in developing countries, first of all, people who are poorer, be able to get access. And so a lot of money is being put up. Gavi, the Global Vaccine Initiative, has set aside $2 billion. Various philanthropies have set aside a few billion more to try to make sure that there is comprehensive, ideally universal access to a vaccine. But it's not going to be easy to achieve. Again, this is an area where the resolutions are encouraging. The WHO has a resolution, but whether that will be able to be enforced against these companies is not at all clear. Sadly, the best guarantee we have right now is the fact that so many different companies are working on a vaccine, which should ideally mean there will be competition. And it's going to be much less easy for one company to simply say, we have the only vaccine and we're going to make it unaffordable for most people and make a fortune for ourselves.
I don't have much to add to what Philip said. It's true that there's several companies making research, doing research in order to get a vaccine. I think also it's important to recognize that for the first time, 100 countries came together in adopting a resolution at the last World Health Assembly that is pushing for coordinated effort to get a vaccine and to make it universally available. What this universally will mean, we will see in future, and it depends also on the greed of some of the richest countries. We saw the attempt of President Trump to convince Angela Merkel to sell the vaccine that they were supposed to propose in Germany, and the same happened with the ventilators, trying to buy as if it was a market competition. I think that we need to be clear and to demand that on issues as serious as health, competition is not possible, and there will be nobody safe if we do not address globally this challenge. In a globalized world, we cannot stop the virus at the border, and we have seen that. Paradoxically, I would say that we are lucky that rich countries have been affected so seriously, because that will push our companies, our politicians, our government to make more efforts in finding a solution. If it was confined just to faraway countries, poor countries, nothing would have happened, as we saw in many other circumstances. So in the disaster, this is a hope that we can share all together.
Yeah, thank you, Philip and Rosa, for your comments and insights. And the plan was that I would briefly summarize what you were saying, and I will give up on that challenge to some extent. But I think there were a few key messages which require further thinking. On the one hand, I think there is a strong recognition globally that health is a human right. And on the other hand, we have the logic of countries thinking only about themselves, about countries feeling that they shouldn't tax that much to address investment, then they're deprived of the resources they would need to do this. The situation also that what I learned here, that philanthropy even is a double-edged sword, because on the one hand it gives the money, but on the other hand it deprives also the institutions of some democratic decision making to say, look, what do people in the countries want the money to be spent on? And I think there's also a key point you mentioned is the importance that people have a say in the health policy, how it takes place, so that we do not have just a top-down technocratic fixed solution, but that we involve the people themselves. So once again, thank you to Philip and Rosa for joining us for this webinar. Thanks to all the participants for putting the questions and for engaging in this debate. And I have one request to the participants. There will be coming at the end of this session a short poll where we would ask you to give us a bit of feedback, because we want to learn to improve the webinars, to think what worked well, what you think should be done differently, so that the next webinars in this online course post-corona needs to start now, meets your needs, and that we can learn from each other how to do this best. I think step by step we become all global Zoom experts, but there's always space for improvement. So thank you, everybody. Thank you also for Adlira, who tried on the run to summarize the questions, who gives this to the audience. And goodbye, and stay healthy.